Hi everyone, thanks for watching our pre-recorded demo of the eligible expenses and budget requests deep dive. This is for the ARPA 606 Dollars to Digitize grant program. This is for provider digital transformation and EHR upgrades. And we'll go ahead and dive in. We have a few topics that we would like to review with you today. And the first is we'll just cover very quickly what the Dollars to Digitize grant program is all about. Then we will discuss what the fall 2022 RFA eligibility requirements are and how we verify applicants' eligibility. Then we will talk about the summer 2023 RFA and in particular the CMA eligibility. We'll talk about eligible and ineligible expenses, the application process and how they will be reviewed. Then I will share with you a quick demo of the budget workbook, which is part of the full application. And we will go over some of the most common frequently asked questions. I'll also provide you a link with the website and our contact info. And by the way, this recording will be posted to the website as well. Okay, so what is the Dollars to Digitize ARPA 606 grant program? We have $18 million available to Health First Colorado enrolled HCBS and behavioral health providers. And this is to adopt or enhance your organization's digital technology. The maximum award per agency is up to $500,000. Who's eligible for the fall 2022 eligibility? First is an enrolled HCBS provider that is actively billing for services provided to 2 or more members on an HCBS waiver. In order to verify this information, the D2D team is using data, billing and claims data from the MMIS system between August 1st of 2021 and August 31st of 2022. Next, Health First Colorado enrolled behavioral health providers are also eligible, regardless of whether or not they're providing services to people on an HCBS waiver. This is for providers who are actively billing for fee-for-service or managed care behavioral health services to 30 or more Health First Colorado members. In order to verify behavioral health provider eligibility, we are using the data time frame from March 1st of 2021 through March 31st of 2022. This is because March 31st is actually the most recent behavioral health encounter data we have available to verify eligibility. And I wanted to give you a little bit more context on the determination of eligibility for the grant program. So we are using Medicaid claims and billing data in a report provided to us by the department. We are reviewing the intent to apply applications, and if approved, you will receive an email from us with a link to the full application. Some provider applicants will receive a denial email, and this will be sent to those who we did not find your agency in the MMIS data report as a Medicaid enrolled provider. Or we did find your agency in the report, but we did not see that the required amount of members were served in the time frame. Now, if you receive a denial email from us and you believe that this determination is in error, we definitely want you to email us back. So please email us back and let us know your situation so that we can work with the department to review your case. As a word of caution, please do not send us your patient panel list. Any PHI or PII is not allowed to be sent to us, so please do not send us this information. We will work with other resources within the department to confirm eligibility. Another instance where you might receive a denial email is if the required documentation from the intent to apply form was not sent to us or was inaccurate. So for the intent to apply, we are requiring providers to send us a 2021 W-9 tax form and a certificate of good standing from the Colorado Secretary of State. And this needs to be sent to us within 1 calendar day of submitting your intent to apply form. I also want to state that when reviewing applications, we're also noticing that some providers are submitting NPI numbers to us that are not matching in the Medicaid database. So please be mindful to submit all of the applicable NPI numbers for your agency so that we can find you in our database. I also want to let you know that there are some disqualifiers for this grant program, and that would extend to applicants who already received meaningful use EHR incentive funding, or if you received a grant within the last 12 months that also provides funding for the same expense category you would seek to request of the Dollars to Digitize grant program. So for the summer of 2023, the eligibility extends to the CMAs. This is because the CMA redesign will be launching around this time, and therefore we will be opening up eligibility for the CMAs. On the screen here, you will see that there is a chart that helps clarify eligibility. So for types of agencies, we have the case management agencies. We have direct HCBS service providers that are not also providing case management services. And then we have the CMAs who also do direct HCBS. So for the fall, case management agencies are not eligible. For the fall, direct HCBS service providers that are not also providing case management services, they are eligible. If you're a CMA and you also provide direct HCBS services, for the fall, you are not eligible. However, if we look at the column here for summer 2023, you will see that if you're a case management agency and you remain within the redesign by the summer, you are eligible to apply to Dollars to Digitize to upgrade or implement an EHR. If you're an HCBS direct service provider only, you're also eligible to apply in the summer. And finally, if in the summer of 2023, you're providing direct services, you are also eligible for an EHR implementation or upgrade. Okay, now I'm going to move on to discuss allowable expenses. And just so you know, we've received a lot of great questions around what's allowed and what's not allowed. And we have posted a lot of information and guidance on our FAQs, which can be found on the ARPA 606 website. So I'm going to review some of the expenses that have been requested and share those with you now. So first, the grant program guidelines for ARPA 606 or Dollars to Digitize is available on the website, and we encourage all applicants to review the guidelines very carefully before applying. Here on the screen here, you'll see the expense categories that are allowed. So first, telehealth systems, new or upgraded telehealth systems are permissible. For new implementations of a telehealth system, a 1-year license is available as long as it is spent before September of 2024 when the grant program closes. We also have devices available to request within this grant program. However, this expense category is still pending CMS approval, but we want you to go ahead and submit your budget workbook with your requested devices anyway, as we're waiting for approval. So do not hesitate to submit your workbook with your request, and then as soon as we hear back from CMS, we will go ahead and review those accordingly. The next category is new or enhanced electronic systems. So this is going to be your EMRs or your EHRs, also electronic billing systems and client management systems. Basically, any electronic system that's going to track and manage patient data and documentation. Next, we have the connection to the statewide health and social information networks. So this would be HIE connections as well as implementing a referral network platform or tool. The funding can also go to technical support, training, and assistance. We definitely acknowledge that a lot of providers will need additional help to implement their project. And we are allowing for 10% allotted for indirect and administrative expenses. Next, allowable expenses. This is going to be more of a deep dive here. So as mentioned before, EHRs and EBS upgrades or implementations are allowed. If you are a provider and you are on paper and perhaps not ready for a full EHR implementation, other software that would accomplish the same thing, but meeting you where you are, for example, QuickBooks or Microsoft Office, that is permitted, as well as client management systems. We definitely acknowledge that a lot of our HCBS providers aren't always providing clinical services and wouldn't necessarily need an EHR, so client management systems are allowed. You're also eligible for up to a one-year license for a new implementation of a telehealth system. Again, must not exceed September 30th of 2024. And then we have devices and equipment here. Again, that's pending CMS approval. We know that for telehealth services, devices are necessary, as with EHRs and other systems and digital transformations that would necessitate the use of devices and equipment. So examples of this would include laptops, tablets, modems for providers and members, and scanning services for a paper conversion, for example. I also want to mention that as it relates to devices, that some members in our communities don't have the devices necessary to equitably participate in their telehealth visits. And so we are allowing devices to be loaned to eligible members, but we cannot gift those devices to the members. So if you have several tablets or smartphones that you would like to lend to your clients to participate in services, that is an applicable use of the funding, but we are not allowed to actually give devices away or gift any devices to any members. Next, as it relates to connecting to the statewide health and social information networks, this would include an implementation and enrollment with Contexture, QHN, CCMCN, and other statewide health social data sharing platforms. By the way, if you are upgrading your EHR system to a interoperability standard and are interested in also connecting to an HIE, there is actually an opportunity for additional financial assistance for your HIE connection. In addition to this, network referral platform tools are also eligible. As mentioned before, technical assistance is included here. So consultants and new part-time staff. And we say new part-time staff because the grant dollars are not meant to supplement existing or supplant existing costs, but more to supplement so that project goals can be achieved. And indirect and administrative expenses are allowed up to 10% of the total grant award amount. And we will get to that in a little bit in the budget workbook. And this can cover the infrastructure costs such as rent, administrative time, licensing, and more. Please see the ARPA 606 grant program guidelines for more information on this. All right, so now we want to discuss what's not allowed under this grant program. And I understand that sometimes there can be gray areas that aren't really clear or obvious. So here are some of the expenses that we've received and provided answers to in the FAQs, but I wanted to share some of those with you here too. So firstly, any expenses made prior to a signed grant award agreement are not permitted. So no retroactive payments are allowed under this grant program. By the way, we are hopeful to get grant award letters out as early as late February, but most likely March and April. So just keep that in mind as you plan ahead. Also, any ongoing costs that exceed the grant period past September 30th of 2024 are not eligible. Supplanting existing costs is not eligible. We also received a few questions from those of you concerned about the tax on the grant award. And the department cannot make any recommendations on how to, any tax advice. So applicants are encouraged to consult with a tax professional if they have any questions around taxes. Devices that are not needed for a digital transformation project are not permitted. Things like servers or improvement to a building structure or like an electrical system, that is not eligible. Things that are not directly improving or enhancing member data or documentation or digital transformation around interoperability and care coordination are just not allowed under the grant's intention. So high-speed internet broadband is not permitted, neither are external hard drives. Electronic visit verification or EVV software or any other software or hardware that's already reimbursable by another funder, like for example, if Medicaid's already reimbursing for those costs, that is not eligible under dollars to digitize. Remote patient monitoring, assistive technology, or other equipment for delivering the actual service is not covered under this grant. Staff payroll systems, for example, are not covered, or any system or technology that's not directly strengthening member documentation and data. So it's all around the members and their documentation. Also, if it's not supporting care coordination, interoperability, it's just not permitted under the grant's guidelines. Next, I'm going to share with you some more details around the application process, as well as how we will be reviewing applications. So firstly, and many of you already know this if you visited our website or attended our other webinar, the first step in applying for this grant opportunity is to fill out the intent to apply form. Now, this form is actually due November 18th, and at the time of this recording, it's November 10th. So we know that time is of the essence, which is why we pre-recorded this for you as opposed to scheduling another webinar that would be live, because we know that that would take a lot of time. So the intent to apply form is really meant to be an initial eligibility screener, and we designed it to take about 20 minutes or so to complete. It also requires that you submit your good standing with the Secretary of State as well as your W-9 within 1 calendar day of sending us your intent to apply form. And what we will do with this information is confirm your eligibility to receive the full application, which is step 2. Once approved from your intent to apply form, you will receive the link to take the online application, and that is due Friday, January 6th of 2023 at 5 p.m. By the way, the full application does include a readiness assessment for user adoption and sustainability of the technology. It includes, you would include categories of the technology you would be requesting in the budget workbook. We also have financial risk questions and a statement of assurances that must be signed by a person in your agency that has the authority to bind the application to the grant award. All right, so let's talk a little bit about how we will be reviewing the applications. So first, I want to state that the maximum award for any agency is up to $500,000. But we do have expense category maximums as well. So we know that some of the larger agencies will probably be requesting the maximum totals, whereas the smaller agencies would not be requesting the max totals. It would just be applicable to your organization's needs. One example of a max award per eligibility category is the electronic health record systems. Under this grant program, you are allowed to request up to $300,000 for an EHR implementation or upgrade, and that maximum would predominantly go to larger organizations that have a lot of members and a lot of providers. We also acknowledge that those of you who are currently using paper to document your processes, implementing a new EHR system can actually be very costly up front, and so we acknowledge that those provider categories would also be requesting close to the maximum for that expense category. We also want to state too that there is a $100,000 maximum available for technical assistance for those who need it most. We will also be looking at feasibility of the request. So for example, if there's a small agency that's maybe serving a handful of members, we would not expect them to be requesting the $300,000 upgrade for your EHR, for example. Also, just to to note that any applicants or applications that come to us that are requesting ineligible expenses will have to go through a process of us determining a partial award. And since that will take us quite a bit of time, we're actually going to be reviewing those last. So if an application comes to us and we see that there's ineligible expenses being requested, those will be reviewed last so that we can prioritize reviewing the applications that are asking for eligible expenses so that we can very quickly process grant agreements and grant awards as soon as possible, as not to delay. And we will be reviewing all applications, but we especially want to give prioritizations to certain provider groups. And that is just to align with the grant's purpose and intention, depending on our available funds. So firstly, we definitely want to prioritize the diversity of our applicants. So providers who are serving rural and underserved communities, as well as our smaller providers, will be prioritized. Also, those who are requesting expenses that are aligned with the grant's intention and purpose. So for example, providers requesting an EHR or a paper conversion, those would also be prioritized. We'll also be prioritizing those who send an application that demonstrates a potential for impact. So a great example of this is the providers who are showing technical readiness, lower risk, and those that are planning to increase interoperability through upgrading an EHR system and connecting with an HIE and enhancing and plans to enhance their care coordination capacity. So if you submitted an intent to apply form and you were conditionally approved to submit an application, what can you expect here? So I just wanted to give you a quick overview of the grant application outline. So just so you know, the application is delivered through an online format, just like the intent to apply form. So what you're looking at here is just a quick PDF outline of all the questions you will see in the application itself. So this PDF document is not the application. It's just an outline so that providers can plan their answers and responses ahead of time before logging in to take the form application. And I just wanted to scroll down here because I wanted to show you the contents of the full application. Again, you will receive a link to the full application when your organization is approved from the intent to apply form. So let's go back up here. Okay. So you will notice that there is a budget workbook that you can click here and download a copy. You will also see that there's a statement of assurances that you can click here and download a copy, sign it, scan it, and submit within 1 calendar day of submitting your full application. So just wanted to make sure you guys were aware of that. And just a quick preview of some of the questions we will be asking, basically to match up with your intent to apply form. And we need the legal business name, as well as the NPIs. And we will also have some questions about the technology and digital tools your organization will be interested in. You can select all that apply. And again, you will receive an approval email from us with a link so that you can see this. This PDF will be referenced in the actual online form so that you can take a look and plan your answers ahead of time. Next, let's take a look at the budget workbook. So in the application, you will receive a link here to the budget workbook. And essentially what we need you to do, the very first thing we need you to do when you open this budget workbook, you'll notice that it opens in a Google Sheets here. And so you have two options. If you go to File here, you can make a copy of this Google Sheet, or you can download it to Excel. It doesn't matter which one you choose, as long as it works for your organization. But the biggest thing is we need you to download a copy because what you're looking at here is actually a public-facing document. So if it wasn't locked down, if any updates you would make to this would be seen by everybody who has this link. And we definitely don't want that to happen. So please use the file icon to either make a copy in Google Forms or Sheets or download into Excel. Okay, you'll notice two tabs here. The default will open to the submission details, and you just enter your information here. And then the second sheet is your budget summary, where you will basically fill out your budget request for calendar year 2023 and calendar year 2024. By the way, you might see some numbers on here. It's important to just scroll down to get some more context on the instructions to use this budget workbook. So I would say is like the next best step is to make sure you carefully review the instructions for submitting your budget workbook. There's different categories that we will need you to describe your requests, and you can fill this out with as much detail as possible, please. And I also wanted to let you know that we have total indirect costs here. You do not need to fill this out because it will automatically be calculated at 10% for you. So let's say your personnel costs, you want to request, say we have $10,000. And then maybe for the equipment you plan, maybe there's $500. And you'll notice here in the indirect line item here for indirect costs, it will automatically calculate this here for you. So please just be mindful of that. You don't have to worry about doing the 10% math. It will all happen automatically here. And then on line 13, you will get your total project cost for 2023 and 2024, and then the total amount here in column E. I also want to point out that we have some more context per category for you to describe what personnel would mean, what equipment means, the narrative of your contract costs would all go here. And if you have any questions about the budget workbook, please email us and I will give you our contact information at the end, but we are happy to answer any questions you have about the budget workbook. And once it's all complete and you have filled it out, we just need you to go ahead and email us your budget workbook, so you can attach an Excel workbook, or you can give us the link to your Google Sheet, and we will be able to review your budget workbook requests at that point. Okay, now I want to share with you some of the most frequent questions we've received and provide some answers. But before I do, I just want to let you know that if you go to our website, you'll see that we do have an FAQs document that is constantly being updated. And we appreciate those of you who have submitted your questions to us. I want to let everybody know that when a question is received by us, we do respond to that person with an answer, but we don't do that until we have publicly posted that answer in the FAQ so that it's fair and equitable. Everybody has the same access to answers to important questions. So a lot of you have asked about devices and when will that be approved by CMS and can they be loaned to members? So we are still pending, we still are waiting to hear back guidance from CMS on devices being included in this grant. As mentioned before, go ahead and put your devices and equipment in the budget workbook as a requested expense as we're waiting to hear back. And I think I did cover this already, but devices can be loaned to eligible members. So that is totally acceptable. The only caveat is they're not allowed to be gifted or given away to members. A lot of you have asked about the taxes on the grant award and could the taxes be covered under the grant? The answer is no. Tax ramifications are not covered in the grant. And the department suggests that providers consult a tax professional on all tax-related questions for the grant. And another great question is upfront funding available for the grant? And the answer for that is no. The grant is going to be delivered on a cost reimbursement basis with the receipt of an invoice only. So what that means is the grantees of the grant program will be responsible for the upfront costs of the digital transformation project and then send an invoice to the department to be reimbursed between 30 and 60 days. We've also seen where tech vendors are working with their clients to be more flexible on the invoicing period. So that might be an option for you and would encourage you to have that conversation with your vendor. And again, please visit our website to review more FAQs. All right, so here is our contact information. Our website has a wealth of information for you, including the grant program guidelines, the link to the intent to apply form, FAQs as mentioned. We also have a lot of materials and resources for you, as well as this presentation will also be uploaded to our website. And after reviewing all of that information, if you still have questions, you can email us at gov.arpa.ohi@state.co.us. And as a reminder, all questions that are submitted to us will receive a response that will also be posted publicly in our FAQs. And we obviously will not include information on identifying information on who submitted the question, but it will be in our FAQs. And lastly, to close us out, we just wanted to, on behalf of the Office of eHealth Innovation and the department, we want to thank you for your interest in the ARPA 606 Dollars to Digitize grant program. And we are here to support you with this RFA process. And we look forward to reviewing your application. And thank you for watching this, this demo and deep dive.